We're going to try to hurry up and get rolling. We had committee before us went a little late, so we're starting late, not because we weren't ready. Secretary, please call the roll.
Oh, that's the Zoom
Oh.
again. That's her stuff up there.
Oh, I got you. I grabbed your folder. Sorry. I don't have a folder.
Senator McDaniel. Senator Mills. Senator Neal. Senator Parrott. Senator Wilson. Representative Graham. Representative Petrie. Representative Tipton.
Here in the room.
Representative Weber.
Present in the room.
Representative Wheatley.
Here.
Joseph Fawns.
Here.
Mike Harmon.
Here.
John Hicks.
Here remotely.
Sharon Mattingly.
Here remotely.
Thank you both. Representative Miller.
Present in the room.
Senator Higdon. Representative Duplessis.
Higdon is here, but he got there. He is.
There he is.
Okay, thank you, and we do have a quorum. Let me quickly give you just a synopsis as to why we're here. As you know, last year this body passed House Bill 8. I like to think it was a transformative piece of legislation that will help put the PPA systems truly back on track, getting properly funded. Those paying what they owe, no more, no less, was kind of the mantra. And most of us can get behind that. And as the bill went through its process, Section 7 was amended into the bill with the purpose to give some teeth to the legislation so that those who had contracted employees out would be, for lack of better words, forced to put those employees back in the system, because it's important that we have members back in that we're supposed to be in, keyword supposed to be in, to help fund the system. So that amendment was agreed to, and what we're finding is, like a lot of things, implementation is sometimes harder than the legislation. So we're having some disagreements on how this Section 7 is going to be implemented. So Co-Chair Higdon and I felt it a good idea, while we're still in session and can do something about it if need be, that we hear from some of the affected parties and from the system as to what issues Section 7 is causing them, what their concerns are, why they think such and such should be not counted in KERS, or why they should, and then KPPA will have the ability to speak to those. And then at the end of that, if any of the representatives from the CHMCs or universities would like to come back and address the body based on what KPPA said, I would encourage you to do that. We're going to have to keep our comments succinct because we're already 15 minutes behind, and your chair has taken too long to get through an introduction. So with that, I'm going to start. Let's see who's on. Steve Shannon. Oh, thank you. That's why we got Brad here. I need to ask if anybody would like to motion to approve the minutes.
Second.
Thank you. So too shall pass. And House Bill 8 reporting requirements. We're going to look at that from Steve Shannon, Executive Director of the Kentucky Association of Regional Programs. And Steve, the floor is yours. Please try to keep it 10,
Yeah.
max 15 minutes.
All right, we'll try to keep it short. Again, I'm Steve Shannon. I'm the Executive Director of CARP, Carp's an association of 11 of the 14 regional community mental health centers. And of that 11, 9 participate in KRS non-hazardous. 2 do not. One never has. The 14 community mental health centers serve about 175,000 people a year, employ about 7,500, and are led by over 300 dedicated volunteer community leaders on their board of directors. We make communities better throughout Kentucky. I really believe that. We have 7 broad categories of issues, concerns, relating to Section 7. The first and most pressing is how will that 60% and 80% threshold be determined? I know in another part of the bill it talks about percentages, but for us, what's the start date? What's the denominator? 60% is 3/5. How is that denominator figure? What's the date on that number? Okay, that's going to help us manage it and understand it. I'll go forward. And the bill doesn't speak to when that happens. The effective date of the bill is March 23rd, 21. Is that the date? Is it a date selected by KPPA? Is it a date July 1 of 20, July 1 of 15, July 1 of 10? We don't know. So I have concerns about that, and we have a really difficult time managing without knowing how to hit that 60 or 80%, and what's the calculation. And again, page 54, 57 talks about it. But, you know, the subsidy we receive, and we're grateful for that. I mean, it's profound. We appreciate that across the board. We also appreciate the Department of Behavioral Health for getting us that money promptly. It flows pretty smoothly for us. But that reduction in 90% to 75% is problematic. So we don't know how to calculate that 60%. We're concerned about that. And the other comments is how does that calculation, how do our business model impact that calculation and our changes that we have to make? For example, if we discontinue a service for some reason, we have a day program, the day program closes, we no longer have staff in the day program, we do a different model. We support people in the community through supported employment and may have other providers do that. Does that count towards that denomination figure? Because we had those employees, now we don't. Do we have to keep them on board? If we don't necessarily want to do that, that's a concern. So we're concerned about, does this allow KPPA to impact private corporations, 501c3 nonprofit corporations, staffing patterns? And does it restrict our ability to make business decisions we think we need to make? The other piece, and it's not a secret, we have employees who have never participated in KRS, right? They never have. I acknowledge that. It's not a secret. We all know that. Will this result in those people enrolling for the first time? And some of those folks do not want to participate in KRS non-hazardous. They won't do it. And they've been reported, if we have to do that, they may resign. Now, that's the message we get. Does that really come to pass? I don't know. We can't staff today. Previous meeting talked about nurses. We can't hire staff. We're challenging. We don't want to have to tell people, you must be in this. Again, they were never enrolled. They have no liability. Again, they weren't participating, so maybe that was a problem. They were never enrolled. If they don't want to be enrolled and they quit, what's the plan? That's not good for us, and it's not good for the retirement system. Doesn't accomplish anything. So we're concerned about that impact, potential liability. Talks about traditional contract positions, and we have those. In our world, the psychiatrist is king. They are top of the pyramid. And any relationship a psychiatrist wants to have with us, we will agree to, because they're really hard to get. They are not many of them, and they're poorly distributed throughout the Commonwealth, throughout the country. So when we have a psychiatrist, we have them as employees because they want to be an employee. We have them their own corporation, and they want us to contract with their corporation. We have psychiatrists that work for a larger corporation that play psychiatrists. All three of those things take place. If the standards used today, traditional contract employee, well, those psychiatrists have to be in, and they don't necessarily want to do that, and we can't get psychiatrists. That jeopardizes our ability to provide that core service that we provide to people every day. We're expanding to primary care. We could have the same issue with primary care, maybe APRNs at some point. But we can do primary care now, and people with mental illness die 25 years younger for things that can be prevented. Primary care matters to us. Is that going to jeopardize this? Will we have to put them in, and will docs say no thank you? It's a concern. Grant-funded new hires. The grant's going to end. Does that count against our number at some point? We have 4 centers, 2 in the system. We're doing a certified community behavioral health center. This is a new model of CMHC. A lot of staff brought on board. It's a 2-year demonstration grant. North Key has one. They participate. New Vista and Lexington have one. They participate. What happens if 2 years CMS says, nope, we're not going to do that anymore in Kentucky? We have all these folks. What's the plan? Does that count against
If
our
I can
number?
interrupt, and I don't mean to, but
Yeah.
wouldn't that fall under hiring patterns that you talked about in bullet 2?
Yes.
I mean, that's the same thing,
It's a
isn't it?
very similar issue, but we have a lot of grant-funded spots. Just why I want to emphasize. So yeah, that's the hiring pattern is a real concern. The next one we have, and this is down in the weeds, is the SEL and Michelle P. waiver programs. Those are waiver services. There's 6 HCB waivers in Kentucky, and this is 2 of them. That program, and we can do it with the home community-based waivers and some ABI waivers, but individuals in that program can opt to have a participant-directed service where they hire the individual. They employ them. They are the employer, okay? We are the fiscal intermediary. We are talking thousands and thousands of people. One center here today has 1,000 people they're cutting payroll for, okay? They shouldn't be included. Pretty clear. Problematic. Some of those folks think they're employed by the mental health center. They're not. They're employed by this separate individual. He is the employer. She is the employer. These folks do incredibly personal things. They help you dress, bathe, feed. They want to hire people they want to hire. They set the expectations. We got to make sure that's an excluded population for those 2 waiver services especially. And we have people doing similar work who has been in. So historically, they could argue they've been in. Another waiver service is family home provider, adult foster care. Many centers have gone from a traditional 24/7 staffed model, 3 people, to an adult foster care. I call it adult foster care because the IRS recognized foster care income. So that's what they do. They live in someone's home. Those people are contracted. They get a per diem rate or a monthly rate to provide supports and a place for that person to live. They are not hourly employees.
And Steve, 2 more minutes if you don't
All
mind.
right, they are not hourly employees. Got to make sure that relationship is not impacted. The last piece that impacts all these across the board. What is the appeal process? We had this experience with employees. We submitted names, and the system was great, but there was no appeal. We don't know this person. Well, it's on the list. It's attributed to you all. What happens here in terms of an appeal process? You know, there's no way to say, wait a minute, we don't think it's wrong. So, again, we just think maybe some guardrails will help us understand how to do it. And I don't recognize health departments, but I had a conversation with them. They've hired a lot of people because of COVID. That population they've hired needs to be addressed because they were COVID. Anyway, those are my concerns. So it's the staffing, it's the appeal process, and how is that number determined? What is the denominator for us to hit 60 and 80%? Any questions?
I think we're going to hold questions to the end if that's okay, just
All
so we
right.
can get everybody up there. Thank you,
you.
Steve, for your succinct testimony. Next, we'd like to call Dr. Caboni from Western Kentucky University's president, and any of your guests, sir. I would ask that you would announce yourselves. And I don't see Dr. Caboni. Okay, so
He's on Zoom.
okay, he's on Zoom. Okay, so if you would announce yourself for the record.
Sure. Thanks, Mr. Chair. Aaron Thompson, President of the Kentucky Council on Post-Secondary Education. I have with me our Vice President and General Counsel, Travis Powell, who's here to answer any questions. I also have in the back of me representing Chief Financial Officers, Chief Business Officers, and so on. I won't spend a lot of time with my regional introduction, just to say that House Bill 8 was in fact so needed in so many ways for our regional institutions whose own KERS and KCTCS. That level dollar approach is truly the right way to think about it. However, over the last many years, you know what we've done in order to be lean and mean, because we had so many cuts in higher education. We had to figure out a business model that gave us efficiency and effectiveness. A lot of outsourcing was done. The main concern we have here really is trying to figure out exactly what that means in House Bill 8 as far as what we're supposed to do from this point forward. I'll let the rest of my introduction go, and I'll let Dr. Caboni talk, and then we'll come back and finish up if he's on the screen somewhere.
Well, can you hear me?
We can.
Yes, sir,
indeed,
we can.
Very good. Well, first of all, Chairman Duplessis and Chairman Hayden, thanks so much for inviting the universities to speak today. I apologize for not being able to be there in person. We are cutting the ribbon on our first year village this afternoon on campus, so I had to remain here in Bowling Green. I do want to begin with this, that we understand the need for a stable pension system, and we've always said that as universities, we are willing to and expect to pay our share of the unfunded liability. We also understand that the decisions made to make the pension system more sound were difficult. But CPE has challenged each of the universities to become more nimble and make financial decisions that best utilize taxpayer dollars. And one of the ways universities have done this is through external partnerships for services that are not essential to our core business. So for example, at WKU, we have contracted on dining services, our bookstore, maintenance and ground services, and health services. These contracts are with third-party vendors and not specific employees. At no point have third-party partnerships been entered into for our mission-critical areas, our faculty and our staff that provide the core services to our students. Many of the contracted services have been performed by a third-party vendor for a significant number of years. And while I understand the legislation, encouraging us to bring those services back in-house with the threat of losing our KERS subsidy would not be in the best interest of our institutions and would create a significant financial burden. It's also important to mention that universities have employees in KERS, KTRS, and our optional retirement plans. Our KERS populations are smaller because most employees providing core business services are KTRS or optional retirement plan employees. Now, at WKU, I want to be clear, we have 1,710 employees that participate in various retirement programs, 1,710. Of those, 339 are in KERS non-hazardous, 619 are in KTRS, and 729 are in our optional retirement plans. Requiring universities to grow the KERS employee base in 2 years will be a really difficult task for us to meet. An accrued liability on any position now provided by a third-party contract prior to June 30, 2019 is already calculated in each institution's amortized payment schedule. Potentially eliminating House Bill 8 subsidy based on positions we're already paying on stands to unnecessarily penalize our institutions. As we've studied House Bill 8 from last year, we've paid close attention to Section 7 and have significant questions over its implementation. We feel it is inappropriate for KPPA to have full authority over who they deem to be an employee for purposes of the calculation. So we have a suggestion. Going forward, we'd like for an independent third-party oversight to be provided over the implementation of House Bill 8 and the interactions between KPPA and participating employers. We think it is imperative to have an open dialogue as KPPA considers implementation, but we need to know what guideposts they're going to use to make their decisions pursuant to Section 7. So we respectfully request that contracts for services performed by third-party partners entered into prior to the passage of House Bill 8 be permanently held harmless from the calculations in Section 7 of the statute. In addition, the definition of regular full-time employees should not include those positions not eligible for KERS participation, which is not clear in the current language. So I appreciate you having us here, the universities, to share our perspectives. Aaron Thompson and Travis Powell are there in person to answer any additional questions on behalf of those participating in the pension. Thank you, Mr. Chair.
Mr. Chair, I'll let Travis Powell finish this conversation up, and then happy to take any questions when the time is right. But I will just say I'm concerned that creating a situation whereby we have to go back and really hire some of these folks back that we seriously don't need at a much larger rate creates the bigger opportunity that we can't focus on what we've asked the campuses to focus on. And that's student success. That's making sure that we provide the needed workforce for the state. And I will tell you, over the last many years, every single one of our campuses have taken such dollars and put it toward last dollar in need-based promise scholarships. And we've gotten the success that you've asked for. And if you look at just the latest data that came out, Kentucky's now number 7 in the top tier of doing this kind of completion. So I would ask us to think seriously about the ramifications of going there. Travis?
Just don't have a lot to add other than in addition to what Dr. Thompson and Dr. Caboni said, I just want to reiterate the importance of making sure that when looking at this percentage, that we're only including those employees that are that could be in KERS. Essentially, the distinction on our campus is if a position requires a bachelor's degree, then it is a KTRS position. And then if it's a KTRS position, they have the option to join KTRS or do the optional retirement plan. And as you can see, the large majority of employees on our campuses are in that category. And so when looking at the percentages, we want to make sure that you're not including those employees in the denominator because we're not ever eligible to be KRS employees. And again, we just want to make sure that our campuses are able to make these decisions based on business decisions on their campus, what makes most sense so they can provide the services to students most efficiently and effectively and not have to worry about whether or not those decisions are going to impact their subsidy receiving from the General Assembly for this level dollar approach.
Mr. Chair, we cut down our presentation significantly, but happy to answer any
You did
questions
well,
you
and this won't be the end of the talk, but this is, we want to get you and KPPA on the record for what you need and what you're looking for and what they're trying to do. Because we don't see you as pitted against each other, but what we see is that there's some vagueness in the law that needs to be corrected to help us give those guideposts. And as Dr. Caboni was talking, I did have a couple questions pop up, and since you finished early, I'm going to take the chairman's right just to ask a couple questions. Then David Eager, we'll have you up here in just a second. Dr. Caboni, I'm very, and Dr. Thompson as well, I'm very sympathetic to what your argument is that folks that are key to education are the ones that should be getting either KTRS or KERS. Those who are contracted out for non-essential purposes, I think those deserve a discussion, not to need that. But as I've kind of dug into this, there are some gray areas, and we'll just bring up Western Kentucky since Dr. Caboni, you're here. Sodexo does a lot of work for you. In my other life, I too have done a lot of work with Sodexo providing services to the university. So I know that some of the Sodexo folks will actually wear, or at least in the past, I haven't been down there in a while, would wear university uniforms that were provided by the university. And maybe that's not a problem, but it does cause some confusion. And then you have supervision, the direct supervision that's fairly low, down pretty far down the food chain that are interacting with those contracted folks that makes it look like you're cherry picking who you want to get a CE or KERS versus who's not. And I'm not saying you are, but that is some of the gray area that we need to try to muddle through.
So I appreciate the question, and I think it's the right question to ask. And my response to that is that did we make decisions for cost-saving purposes for the university? Absolutely. That's what we've been charged to do. And the question for us is, having folks as university employees doing that work, is that the most efficient use of scarce taxpayer dollars and student tuition dollars? My answer to that is absolutely not. Do we have them wear WKU branded logos on their? Yes, we do, because we want every student to know that no matter the employment relationship with the university, the service is designed to support them in their experience, whether it's core or tangential to our core mission. But I will say that if we've had to bring, because we do have a renegotiation coming up, if we have to renegotiate, anytime we renegotiate, bring folks into the system, that will cost the university millions of dollars that we were charged to reduce in expenditure. And my fear is that an additional multiple millions of dollars in cost to the institution will be borne by, not the institution, but by families and our students. And it's really, I think, not in the best interest of the institution or operations to do that. Lastly, the point about we're already paying the liability on folks who were KERS employees. That's part of the calculation. Going back and re-adding makes little sense to me. Again, I'm getting out over my skis in terms of the technical details there. And Travis, you can back me up on the technical nature of this. But from a strategic perspective, I will say this makes zero sense for our institutions, not just WKU, but for my colleagues as well. This will be a burden placed upon students and their families because we want to add additional employees to our pension system.
No, I would agree with everything Dr. Caboni said. And there's
Microphone.
I'm sorry. I would agree with everything Dr. Caboni said, and I would just reiterate. I mean, there's really no reason at this point with the level dollar approach that's in place to avoid the retirement system for any reason right now. I mean, now they're just going to pay the normal cost. So if a business decision was made to bring somebody back in, I mean, that would be just made on the business piece. There would be no consideration essentially for the retirement piece because that's already, the unfunded liability portion that was such a large percentage before when they were paying per employee is taken care of by this by House Bill 8. So really, it's all going to be based on the business decision at this point moving forward. Obviously, unless not considering the current subsidy piece and making sure that if that piece is taken care of, so we don't get a negative recommendation. But otherwise, it's a business decision now because bringing folks in, it's just you're just paying the normal rate moving forward.
Fair enough. All right, I think you did an excellent job. If you don't have anything else, I'll ask you to hang around in case some other questions come, though.
Thank you, Mr.
Okay.
Chair.
Thank you.
Thank you.
Mr. Eager, if you would come and introduce yourself and your guests and give us your 10 to 15 minutes discussion on what you've heard from the universities, from CHMCs, and also your own perspectives.
Mr. Chairman, I'm David Eager. I'm the Executive Director of the Kentucky Public Pensions Authority, and I have two of our employees participating in this presentation. And with your permission, I've asked a third person, Aaron Surratt, who's our Executive Director, Office of Benefits, because it's hard to tell where these questions are going to go. Michael, you want to introduce?
My name is Michael Board. I'm the Executive Director of the Office of Legal Services.
I'm Rebecca Adkins. I'm the Deputy Executive Director of KPPA.
I'm Erin Surratt, Executive Director, Office of Benefits.
The floor is yours. Please proceed.
Okay. I brought along a one-page document I've prepared recently called Key Messages to Legislators, 6 key messages. One of them says, legislative changes may take considerable time. And I think it's easy to say, let's have 60% at one point and 80% at another point, but you can see the complexity of the kinds of things that come out of that in terms of implementation and regulation. Why don't you go ahead? Page up, page down. Yep. So there are 100 agencies, employers that are affected by the 60%, 80%, and I'll just use that term. And there are, let me get my notes. So you see 60 health departments, 24 non-P1s, 10 regional mental healths, and 6 universities. That's a total of 100. There are exceptions for agency employers not being included. There's a list of some below that are not being included, but that's the universe we're talking about. Okay. So, KRS non-adjunct employers, they're to provide information to KPPA. We're going to talk about what that information is and the timeline and so forth on all independent contractors and or leased employees not directly employed by KERS non-hazardous. They're also to provide information on any persons employed directly who will meet the definition of a regular full-time employee who are not being reported to the system. I don't know that we have an idea how big a problem that is, but it's a problem where there are employers who do not report. The exceptions, original contracts entered into prior to January 1, 2021 for services provided by an independent contractor, leased employer, or other employment arrangements other than direct employment. And the second exception would be contracts for professional services that have not historically been provided by employees of the KERS non-HAS employer. So here's the definition, regular full-time employee. It's essentially, the starting point is the amount of hours per month worked. It's 100 hours, in excess of 100 hours is considered a full-time employee. There are exceptions below, seasonal positions, not to exceed 9 months, emergency positions, not to exceed 30 days, temporary positions, not to exceed 9 months, part-time positions, again, that don't exceed 100 hours, and interim positions that are established on a one-time basis and also don't exceed 9 months. So we have the definition of who this applies to, and definition of the employees that are under consideration here.
I'm going to talk to you about the timeline a little bit. So we emailed all our employers on Monday of this week, the 21st. It's a pretty short email that says, in big bold letters, there's a reporting requirement you need to know about. We sent that to the reporting official, who is our primary contact at agencies, and to the head of those agencies. It links them to the website, where all the information is also held on the website. I believe 181 people received that email on Monday. So that was Monday, the 21st of February. They have 8 weeks then, including this week, to fill out a Form 6756. We'll look at that form here in the next couple of slides. This form allows them, kind of talks them through the process of reporting to us who are contract employers, do they have contract employers, those kinds of things. That is due for persons under contract by that agency between July 1 of 21 and the 15th of April, on the 15th of April. Then if they hire again between the 16th of April and the 30th of June, that is due on the 30th of June. Nothing prevents them from having multiple entries, but it will be easier to keep everything straight if they will have one entry on the 15th or before the 15th and one entry before the 30th. And then August 29th is statutory 60 days after the end of the fiscal year, which is June 30, for us to provide this information both to LRC and to the Office of the State Budget Director. So talking through it's a 4-page form. The first section is just basic employer information. The second section is allows the agency to say, I don't have any contract employees, non-employee employees, as defined by 61510. The third section is about independent contractors and gives them a place to provide some of that information. The second page is all third parties. The fourth is providing information about independent contractors and leased employees. And the last page is just certification that, things like they believe these to be all the information that's available to them. The information that they're looking for is contracts.
So the, the historically been provided by an employee language that's currently included in Section 7 of House Bill 8. KPPA will review those contracts from the prior fiscal year to ensure that the employee is a term that's being utilized correctly. We'll review those. We'll do that annually to determine if that ratio is correct. And how an employer designates that position is not going to be binding. The way KPPA plans to review those will be to apply the common law factors that are applied by the IRS. And the IRS currently has 20 factors listed, but those 20 factors are really more applied in broad categories of control that they look at for an employer's control over an employee. And so we'll be looking at those common law factors that the IRS looks at to determine whether someone is an employee or a contractor.
Quickly, I'm going to jump in because this first bullet really hits on one of the bullets that the CHMC's brought into account. Define for this committee how you see historically been provided, what that means, what that date is. Is that Is that when House Bill 8 was passed? Is that when 1953 or whenever it was when KERS was created? How are you interpreting historically been provided? Thank you.
No problem. As it currently stands, our current interpretation of what we plan to include is that we would determine that by if the professional services have ever been provided by a direct employee of the employer, then they would not meet that definition. Then those have historically been provided.
So, for instance, when Dr. Caboni talks about they've contracted out their lawn maintenance now, that's
Yes.
all contracted. Well, those used to be university employees in the 70s and 80s and 90s.
Yes. And the
What
date,
you're going to say those folks need to be brought back in. That's how you're interpreting this law.
yes, currently. And the date we would use would be the employer's participation date. That's currently the date we will use.
Employer, not employee.
Yes, the employer's
Thank you.
participation date. So the next slide just lays out a brief listing of these common law factors that the IRS utilizes for determining whether someone is an independent contractor or an employee. We are currently drafting a regulation to implement this portion of House Bill 8. And so we hope to have a draft of that regulation ready in the next couple of weeks so that we can have that available. That's our current plan.
Does that wrap it up?
That's
Okay,
it.
so you did
I'm
good.
sorry,
You
Representative Duplessis.
yes.
I do have an answer to, I believe Mr. Shannon is the one who asked, how do we calculate the percentage? That's in
The denominator, right?
Yeah.
Yep.
The 3C says a percentage computed by dividing the number of employees reported in paragraph A. That's the number reported during the prior fiscal year. So we're looking for subsidies for fiscal 23. So it's fiscal 22 reported employees, the ones that you're reporting to us on April 15th and again on June 30th, and on your normal reports during the year. So we will take all of them who have been reported that year. They don't have to be active as of June 30. It's all of the ones during that, and combine that number of employees and persons reported in paragraphs A and B, the contract or leased, and divide them. So that's total employees and contract employees. And
So you're looking at 21 versus 22, not historical. Or do you look at job classification and that gets added to what 21 should have been?
I think the historical is related to job classification.
Yes.
So what you look at for 2021 will be actual employees plus what you deem as employees that should have been there. So that denominator will have a plus to it, correct?
Well, they'll be reported to us on this form of that number. So the total that reported to us on their monthly reports and the total reported
Gotcha.
on the form that were determined.
Those will all add together to create that denominator.
Yes.
So I'll just throw out an example that I think needs to be corrected in your favor. Mountain Comp Care, well, I don't know if Mr. Shannon represents them or not, but they have 1,388 employees in a side business called Mountain Plus, which provides employees to do their core business, as I understand it. They created that because honestly, pensions got totally out of control there for a while, so it was a way for them to manage their costs. But now, if I understand it, they will be included into this calculation, that 1,388 that currently don't work for Comp Care but work for Mountain Plus. They will be counted, correct?
Yeah.
Okay.
If they're reported on the form.
And I can agree with that, but I don't know that I can agree with if Sodexo's employees are being counted towards that. And I think that's where we need to kind of figure out what these guardrails are. So with that, thank you for your presentation. We have about 5 minutes, and I have one person who'd like to ask a question or speak, and that's Senator McDaniel. And then I'm going to have Steve Shannon and Dr. Thompson and/or Caboni come back up and answer anything from what they've heard, and because we want to get this right before session's over.
Yeah. Mr. Chairman,
Yes.
I didn't know whether staff had any other responses to Mr. Shannon's.
There, one more.
Yeah. If you permit that.
Yes, please.
There was a question that came up about the employees of universities specifically because they report to KERS and teachers, and they have their optional. Whether all of those employees in all three of the plans would be considered, we're only considering those employees that would be reported to KERS, not the total in all those plans.
Okay,
So I wanted
thank
to
you.
clarify that.
Senator McDaniel.
Thank you, Mr. Chairman. I just have a statement. So guys, a lot of you heard from me last year that I was looking forward to this year coming up because finally we were going to quit. When I talked to Steve Shannon, we were going to talk mental health policy. When I talked to universities, we're going to talk university policy. Because all we've done since I've been here is allow the financial tail to wag the dog. But yet we're back here again. Let me start with this very simple admonishment. If you guys don't get on the same page, and if you want a legislative fix, the chairman's right, we want to get this right. But you bring us something adversarial, and the first thing I'm going to do is push for elimination of all subsidies that are going to these organizations. I wasn't for it in the first place. The chairs worked very diligently to have it included in there. All public policy boils down to finance. And I sit in the seat where all of this collides in that one big amalgamation of a state budget. And now for the first time in a decade of being here, we have a little bit of extra money because we've dealt with expanded pensions, recessions, and Medicaid ever since I've come here. So I want to give you guys an admonishment. Come together with an easy solution for this committee, because you start a fight and you're not going to like the outcome. This committee worked. You guys got a bill vetoed one time by the governor. You came in with a solution, then you didn't like the solution. You came back for another solution. I'm not going to be for things that reduce accountability or increase burden on the general fund. We've been down this road for too long. It's time for the quasi-pension issue to be solved. Chairman Duplessis, Representative Tipton, Representative Miller have worked diligently on this. And I'm not going to be for dodging basic accountability. I'm not going to be for more third parties. I mean, goodness gracious, how hard is it overseeing, what we've got now? We've got to look out as a General Assembly for the whole state, not just quasi-employers. You guys are critical. You have critical functions. We want to help you with those critical functions. But bring us another mess, and I caution you, you're opening a can of worms here. The general fund has absorbed as many of the questionable employees as I think is reasonable. There might be a couple ones and twos out there still as we work our way through this process. But it's time to move past this. And if we get brought some mess, you're going to reopen everything. And I don't think any of us want to go there. Thank you, Mr. Chairman.
You're welcome. And I would like to, I don't know if maybe I'm not totally on board with what he said, but not totally. If you look at industry, and I'm going to use Toyota because Toyota is one of the star industries in our state. Ford can make the same thing and several others, Dow, lots of, but I'm very familiar with Toyota. Toyota contracts the company that I work with out to do environmental concerns. They hire out somebody else to do their paint mixing and all this. They hire other groups out to do water treatment and other things. But when it comes to making Camrys, it's all on Toyota employees. But grounds maintenance and things that are ancillary to the making cars, they've contracted that out because they figured out we're really good at making cars, and that guy's really good at treating water, and that guy's really good at cutting grass, and this guy's really good at maintaining parking lots or what have you. I'm okay personally with universities and even CHMCs not having folks who aren't core to their business in there. But when we see things like Mountain Comp Care that has 1,388 employees and a side venture that's supporting what they're doing is their widget. They're doing mental health, and when their core business is being supported by these employees, but they're not in the system, I think that's who Senator McDaniel and I totally agree with should be part of the system. They were before, they should be now. Now, as markets change, as business models change, I think somebody said, it makes sense. We need to have some flexibility. And I do think that House Bill 8, because of its level dollar based on historical, already takes care of some of this stuff. The universities have a set pay they're going to pay regardless of who's in their system. But what we don't want to do is have this happen again. So I've spoken with, is it John?
Michael.
Michael, I'm sorry, Michael.
It's okay.
He told me early today, we will have you regulations in 2 weeks. And I appreciate that because we need those regulations because, as Senator McDaniel said, you either give us regulations we can live with or we're going to give you regulations we can live with. And that might not be something you like. So it's best if you guys all get together and figure this out. So, Dr. Caboni, do you have anything you'd like to add after you've heard KPPA?
Yeah, I'll be very brief, Mr. Chair. First of all, I think that obviously we all want to get to a stable pension system. It's what we've agreed to do as institutions. We think we're meeting our obligation to pay for the folks who are in that system and to pay for our portion of the liability. But the idea that going back to when we joined KERS, which is what I heard earlier in the testimony, that any employee that would have done any of that work when WKU joined the pension system until now, that seems to me to put us in tension with the Pension Oversight Board. And so I think that what you have here is public policy that is creating a tension between what I have to do and what I've been hired to do, which is to take care of students and do the work there versus trying to get additional folks into the pension system to shore it up. I think the other challenge that we have, and this is something that we all are focused on, is transparency. The pension system is a black box to university presidents. And I would like for us to be able to open up that black box, see the decision-making process, understand why it is an employee is or isn't considered an employee, and not just have to take whatever comes back to us from KPPA. And I appreciate the challenge that Mr. Edgars has. It's a different challenge than mine. And so I would look to the legislature to help us, assist us, and come to a good conclusion, because at the end of the day, my job is about one thing: educating more students for the welfare of the Commonwealth. And it's not about cutting grass. And anything that I can do to outsource or make business decisions that are in the interest of our institution is what I've been charged with doing. And so I do think we have a tension there. And I certainly appreciate Senator McDaniel, and I agree. The last thing I wanted to talk about this year was pension. And I would like for us to get this all cleared up, and we're willing to work with anyone.
And I would encourage you in the next 2 weeks, as Michael and his team work on regulation. Michael, I'd encourage you to reach out to Dr. Caboni and Dr. Thompson and the folks that are here, and the Steve Shannons and the Laura Owens that are representing the CHMCs. Make sure that, and I'm not asking you to kowtow to them, but understand that there's the situations they're in, so that the legislature doesn't have to get involved.
Yes, sir.
Thank
Absolutely.
you, Steve. You need anything before we go?
Real quick,
And then we got to go.
cherish the opportunity to discuss mental health services with our A&R chairperson and chair. And I agree with you. I thought this was going to be a tension-free session. So did my wife. Because you're back here again on pension. So I agree.
Okay. Thank you. Unless there's any other questions, this meeting is adjourned.